Hi everybody, it's Professor Shrenzia. I just wanted to go over a few things on your endocrine worksheet, drug worksheet from Module 10. As you can see from the slide here, we are in the module and you can find, and I'm sure most of you have downloaded your endocrine worksheet already and have started that. So I'm going to pull it up here for you and kind of just go over a few things that I want to make sure that you have on your sheet for the exam, for the upcoming exam. So the insulins can be found on page 798 and 799 in your text. And insulin in general, some of the important things that you need to make sure that you are aware of is the onset and the peak really of the medication. Especially, let's start out with our first types of insulin here. Your book calls them short-acting insulin, but you can sometimes hear them referred to as rapid-acting, and that would be your insulin aspart and lispro. So we know that for these two medications, our onset is about 15 minutes, which is faster than regular insulin, which we will get to if we look down on our sheet here a little bit. We have right below it, we have regular insulin where our onset is about 30 minutes. So with aspart and lispro, it's important to know that we need to give about 15 minutes before their meal. So we need to make sure that they have something available for them to eat when the insulin would start acting, which is, again, about 15 minutes. For the other adverse effects, pretty much with all of the insulins, is going to be hypoglycemia. And signs and symptoms of hypoglycemia, again, are important to be able to recognize in our patients, and we can find that on page 801 and 802 on our text. Another general thing that we should know about insulin is that it's most rapidly absorbed from the abdomen. So we want to make sure that we let our patients know that is the best place to inject insulin, but we are always rotating sites, not always in the same area in the insulin, so that we can avoid any complications in the skin there. It's really important when we are teaching our patients about insulin that they understand too the onset and the peak of the insulin, so that they know that they need to have food present at those times to avoid causing hypoglycemia. So our insulin aspart and lispro, are going to be given about 15 minutes before the meal, as opposed to regular insulin. Again, our regular insulin, an important thing to know about regular insulin is this is the only insulin that can be given IV. So it would be our insulin of choice in an emergency situation of hyperglycemia or DKA that we learned about, or HHNC. We would want to give something that we could give IV to get that blood sugar down quickly. But we also do give regular insulin sub-Q as well, or subcutaneous. A side effect of regular insulin is going to be our hypoglycemia again, and any of the lipohypertrophy at the injection sites. The next insulin is going to be our NPH, or our intermediate acting insulin. So this insulin is different in that it peaks at about 8 to 12 hours. So what's important to know about this is that when we give this insulin, we know that the greatest risk then for hypoglycemia would be 8 hours or so after we give this medication. So if we were going to give the dose early morning, late afternoon, mid to late afternoon would be when the patient would be at highest risk for hypoglycemia. So they need to know that they need to be able to eat at that time. NPH is also our only cloudy insulin, and that is another difference with this medication that we should be aware of. Then we have our long-acting insulin, or our insulin glargine or detamir. So what's really important to know about insulin glargine is that there is no peak of action. So this is a constant level. Its duration is about 24 hours, and this is why we call it a longer acting, call them both a longer acting insulin. This is usually the insulin that we give for a basal insulin. Remember, way back in Module 1, we talked about basal and bolus dosing. So a basal dose of insulin is something that we give that's going to last the 24 hours. And then we will give bolus doses of the other insulins to kind of help lower those mealtime insulin blood sugars. So that's the important thing to know about the long-acting insulin. So for hypoglycemia, because that is one of the side effects that we one of the side effects that is common for insulin. The treatment for that, I believe, is found on page 800 in your text. So you should be aware of the treatment. In general, some of the treatment for the other medications, the oral medications, and also some of the other anti-diabetic medications, the teaching can be found on page 806 and 807. So that's a very important teaching box to be aware of for this, this module. So I'm going to kind of go through a few of these, not all of these medications, but there's a couple of them I wanted to make sure that you were aware and that you had this information on your sheet. So metformin is one of our biguanides, and you should know that one of the adverse effects for metformin is lactic acidosis. And it doesn't cause hypoglycemia like some of our other oral medications. The other thing that's really important about metformin is we need to be aware that when we give, when a patient has to receive some contrast dye that has iodine in it, if they're going for some sort of test, they may be at risk for some additional renal problems. So we want to make sure that we discontinue metformin at least 48 hours before and through 48 hours after the test to make sure that we limit that or lower that risk for any renal problems. It's really also important that metformin can cause some GI upset, and taking it with food is really one of the important things that a patient can do to kind of minimize that. We'll also gradually increase this dose, the doses of metformin, so that we can minimize some of that GI issues. I'm not going to go through each one of these of the oral meds, but you kind of get the idea here when we go through and we're talking about like why we give the medications, some of the major adverse effects. I did want to go down to the rosiglitazone maleate, for example, and note that there is a black box warning for this drug, and it would increase the patient's risk for CHF. So instead of just understanding that it increases their risk for CHF, which that is important, but what kinds of things would we want to make sure that we're assessing for in our assessment? We may see in our assessment findings. So we would be, of course, auscultating lung sounds, and if there were any crackles or any fluid, we would want to note that. And remember, from health assessment, you know that we're listening for extra heart sounds for CHF, and audible S3 could indicate some heart failure. And we also would want to monitor, there's some risk for liver toxicity, so we are monitoring liver enzymes with this medication. So if you go through your drug sheets kind of like that, making sure that you're aware of what any black box warnings that there would be for the medications and any specific nursing considerations, those are some of the real important things that you want to make sure that you have on this drug sheet, and that you are making sure that you are not really memorizing for the exam, but understanding some of these adverse effects and the method of action for some of these medications as well. So I wanted to kind of jump down. I did get a couple of questions on the thyroid medication, so I kind of wanted to go down to levothyroxine and make sure that you understand that this is a medication used to treat hypothyroidism. And so if we are using it to treat hypothyroidism, we would need to know some of the signs and symptoms of hypothyroidism. So again, if we're using it to treat hypothyroidism, then we need to know that some of the adverse effects to this medication could be hyperthyroidism, right? So tachycardia, MI, heart failure, some of those kinds of things we want to make sure. Nervousness that we're looking for when we're giving levothyroxine. That would be some of the adverse effects to this medications. For any of our thyroid medications or thyroid disorders, we want to make sure that we're monitoring our TSH level. TSH, or thyroid stimulating hormone level, is the most reliable level for thyroid function. So that's the one that we're going to be measuring the most. PTU, you guys did a really great job with PTU on your discussion boards. So I'm not going to go over that one, but other than to say, which most of you got this, is that there is a black box warning for PTU for liver injury. So of course, we're going to be monitoring liver enzymes with that medication. And finally, the radioactive iodine. So that is found on page 833 and 834 of your text. So I wanted to make sure that you were aware of where you could find that, and that that medication actually will destroy thyroid tissue. So if we're destroying thyroid tissue, it would then cause hypothyroidism, which means that the patient would need to be on thyroid replacement therapy or the levothyroxine, and that would be probably lifelong therapy. Another important teaching is that because this is radioactive material, we want to teach our patients not to cough or spit for 24 hours because they could have some radioactivity in their saliva, so that they need to be aware of that. The other med that we talked about, and you can see at the bottom here, and everyone did a pretty good job of this in their discussion board, is propranolol. So that is a beta blocker. Remember from way back in the cardiac and blood pressure that we use this in that module. So go back to module 4 worksheet if you're not clear as to how this beta blocker works. You need to be aware that this does not do anything to change your thyroid hormone levels, but it does control some of the symptoms that a patient would have with hyperthyroidism. So again, we want to make sure that when we are stopping this medication, just like we told our patients before, that we don't want them to abruptly stop. We want to make sure that we taper that medication. Some of the other meds that are listed on the bottom here are adjuvant medications for diabetes. So again, you're going to need to go back to your module 4 and 5 and make sure you understand ACE inhibitor and the ARBs or losartan and your statins or simvastatin, and understand that these are adjuvant medications that we would give to a diabetic patient. So I think that that kind of covers mostly. I'm hoping that this helps a little bit, just making sure that you kind of understand a little bit more about the drug worksheets. Please let me know if you have any additional questions, and I would be happy to answer them for you. And that's it. Good luck in your studies, and let me know. Let us both know if you have any questions. Okay, bye-bye.